Toggle to the word, hey, to all my mates. We are the Togolese future. We the ones who they make it better. No one's possessing the future. All we need to do is working harder. As a father, the mother is the father. Rest to the Almighty's power, not to the privation of being reader.
Hello everyone, my name is Cedric. I am from Rwanda, Kigali, small country in Eastern Africa, and I currently live in North Carolina, Durham area, and I'm taking general education courses for my nursing program. So you already know my nursing program leads to my nursing major. So my motivation to go in nursing was like when I was little, like probably like 13 years old, 12. I used to like biology and anything that has to deal with human body. That's what made me like sciences. When I got here in North Carolina, Durham, I learned that you can actually get in the medical field without being a doctor. So I went the easy route, being a nurse. And what you can use the nurse degree for, you can be a registered nurse. I mean, we can work in the hospital, clinic, nursery facilities, and other like for insurance companies. But I chose to go for a hospital setting because I like to help people, deal with their health. So that's the first thing you can do with nursing degree. With the other thing, you can actually add 3 more years or 2 years to get into master's degree, and then get you can be a nurse practitioner, not an anesthesiologist, and you can actually be physician assistant, but it will take you 3 years while studying full-time. I mean, you don't have to take a breaks. It's just full-time, 5 days a week. A day you have to go to school. That's the thing you can use for nursing degree. Okay, during my education, and I'm still in school right now, I have encountered a lot of obstacles, and one of them was language. Actually, when I got here, you can't understand, I got accent, so yeah, my English is still not good. But when I got here, I got language obstacles like speaking. I had a thick accent, like thick accent, and then it was kind of language barrier for me. I couldn't talk to instructors. Sometimes I had a hard time understanding their accent too. But when I was in summer, I went to find a job, a part-time job. Luckily, I got a restaurant part-time job, and then they told me I gotta know English. I'd say, this is all I speak. Can you just give me a job? Yeah. And then the reason why I chose restaurant is because every day when you work, you interact with people. You gotta get used to their accent. They get used to understand you, so you develop some kind of culture. I wanted to be, fluent in English. Luckily, sadly, I don't work there anymore. That's my main obstacle right now I'm still facing. But the other one was, we got COVID-19 right now, pandemic. It's kind of affecting my learning because we're doing online classes. They're kind of hard than usual classes because we don't usually get a lot of time to study. Like studying at home, we got a lot of distractions. One other difficulty I faced was actually the culture, like getting used to the culture, because I got African culture. I'm not sure I'm gonna lose that anytime, but it's kind of getting used to American culture. I know a lot of people right now saying they don't got American culture, but they do got American culture, and then you gotta get used to it, in order to survive up here. So I'm currently working on that, but I'm making sure I don't lose my own culture. Okay, as you know, as I said before, I'm doing nursing major. So what I like about nursing is it gives you all kinds of experiences in medical field. They say I want to be in the hospital. So let's say I want to be in an emergency room, because a lot of people come in emergency room with different, a lot of patients come with within different diseases. So I would get my hands wet in everything. Let's say somebody got a heart attack, I would just know how to deal with that. I just know somebody broke their leg, I would know how to deal with that. That's the thing I like about nursing. And then the other thing, being a doctor, it doesn't really say you know how to take care of the patients really closely. All you know is, you know, they gotta take these meds, they gotta sleep, they gotta do this. But the nurses are the one like by the side of patients, and they like to help people. So I was like, if I do nursing, I'll be doing two jobs, right? I'll be helping people closely and doing the medical stuff. So I was like, nursing is my best choice for now. Then pursue it. And then what I don't like about nursing is when you get to a master's degree. Let's say nursing, with the nursing bachelor's degree, you can get a lot fields in the medical. Like you can get a lot of medical fields careers. Like you can be insurance. You can work for health insurance companies. You can work for governments or facilities like social services. You can work for. You can go in nursing homes. The homes for old guys. You can work in the hospital and the clinics. You can work with our family doctor. You know, somebody have their family doctor. Let's say the doctor who takes care of their family. You can be the nurse. You can work in schools, school nurses, and you can pretty much work in pharmacies. You can work a lot with a nursing degree. And the thing I don't like it when it comes to master's degree, you can. I said earlier. I said you can get in medical school. You can get in physician assistant school, PA school, but when it comes to nursing schools, like master's degree, you only get like two choices. Either become a nurse. Actually, it's actually like four. You can be a nurse practitioner, nurse anesthesiologist. You can be a nurse educator. You can be a nurse. I forgot their name, but there's nurses that take care of technology, like nurse IT. But they don't dive into IT a lot, but they try, you know, to do IT end of nursing, like the communication, the IV machines, the life support machines. They take care of all those. And then nurse educator, you know, when you get in the hospital, when they get new nurses, you're the one taking care of them, making sure they got the experience they need. And then nurse practitioner is more likely a doctor. They can operate without approval of a doctor. You know, a doctor is the one at the top. And then nurse practitioners, then physician assistants. Physician assistants is like they're more likely to be nurse practitioners, but the physician assistant, they have to be supervised by a doctor. But while nurse practitioner, you can actually work independently. And then the good thing between the difference between what I like between if I was to choose nurse practitioner or physician assistant, I would go with the physician assistant, because physician assistant, you get options to change your concentration easily without going back to school. For example, I am a dentist, right? I'm a physician assistant dentist. I can change to emergency room a physician assistant without going back to school. But nurse practitioners, they have to go to school. Let's say I want to work in pediatrics, kids, you know, and then I am a family practitioner, nurse practitioner. I would have to go to school to earn a degree for pediatrics, and then that's the downside of being a nurse practitioner. The other thing is a nurse, they help patients a lot. So they're caregivers. They give them care with, like, that's their job, to take care of the patients. So if you make sure your community is healthy, the patients, let's say they got heart attack, so you're gonna have to make sure they're having appropriate care so they can stay in your community. You know, heart attack is not a joke. It's a fatal disease. Actually, you can die instantly over there. So giving them the care they deserve will help you stay connected with your community. Let's say it's not your family, it's your neighbor. They got a heart attack. So if you take care of them, they will still be your neighbor for like more years to come. But if I'm not saying you have to
Togo to the word, hey, to all my mates, we are the Togolese future. We the ones who they make it better. No one's possessing the future. All we need to do is working harder. As a fathers and mothers, the father. Rest to the Almighty's power, not to the privation of being reader.